Now, from medical point of view, little we know about that. Still, it is like the researches on hijama is in infancy state. But what we know is already quite strong enough that will make us to do hijama. So, and again all the time I believe that there's so much hidden in hijama. It is beyond the pathophysiological pathways that we can understand about hijama. So inshallah, many things we understand, many things don't understand, just because it is the saying of Rasulullah. Inshallah we do that, inshallah we benefit from it, and also we benefit from health, and also we please Allah and we revive one of the Sunnah of Rasulullah. Everyone these days talks about donation of blood. All the doctors, they say, okay, donate blood. Particularly cardiologists, they say donate blood because it is good for coronary artery condition or heart diseases. Why? Because one of the risk factors for heart disease is iron overloading, for example, because the iron oxidizes, and when it oxidizes, it oxidizes the cholesterol also. It makes more LDL, the bad cholesterol. So it is one of the things. There's a Dr. Philip D. Christopher. He's the director of the Loyola University's blood bank system. He says, people have too much viscosity in the blood, and he gives an example. He says that it's like blood is like molasses. It flows like molasses, like it's very sticky, and this stickiness or high viscosity of the blood causes a lot of damage in the arteries and causes a lot of plaques also in the arteries. So he said it's really a good idea to go and donate, and he encourages that we should be a regular donor actually. And there are so many studies about that, and there's one American Journal of Epidemiology. They have found out through the meta-analysis, pooling of many studies, that the regular donors, they have 88%, they are less likely to develop arterial condition like heart condition, coronary artery diseases, and they say less likely to have strokes and even cancers. So it's one of the best things you can do. Now, it is even there's a study, actually a couple of studies about that menstruating ladies, they have lesser chances of having heart conditions than the postmenopausal ladies. So once they go into the menopause, they stop the menstruation cycle, they have higher risk of coronary artery condition in comparison to men actually. So this gives a good example, because they are menstruating, so there is a recycling of the blood. So men do not menstruate. So there is a really good alternative for men that they can have hijama done. Now sometimes we can think, since women are menstruating, do they need hijama or they don't need hijama? Well, hijama, like extraction of blood, is just one of the many factors how hijama helps. So still there are so many other factors, for example, the pricks we make, they cause a lot of secretions of many positive hormones. So still, it's good, even if they are menstruating, they can do hijama inshallah. But of course they don't need so much of hijama pricks like men do in comparison. So it's a good idea for them also to get it done. Now this is the studies is just about the donation of blood. How about hijama blood? Hijama blood is a little different from simple donation, because hijama, when we make pricks, we extract the blood out from the interstitial tissue spaces. So this blood is not just the fresh blood, because when we donate, this blood is from systemic circulation, and it's a comparatively fresher blood. But hijama blood has a lot of debris and unwanted things with that. So it's toxicity and lactic acid and lymphatic fluid, so many things. So it is really, so if you do hijama, it is even much better than simple donation. The other is just the pricks. So when we make pricks, it causes a little injury in the local area. So this injury, there are so many studies done on that when it's like hijama is a planned, sterile and controlled injury made to the skin. So as a response, it's like it causes physical disruption of keratinocytes in the epidermis, and this as a result causes activation of innate immune system. We have two kind of immune system, innate and acquired. So innate immune system gets activated, and as a response it causes secretion of a lot of AMPs or antimicrobial polypeptides, and then they take care of the local issues, if it is debris, if it is the worn out cells, or whatever the toxic waste, etc., etc. So it's good. And then other is it has some inflammatory responses. When we make pricks, it's like an inflammation on subclinical level. So inflammation is a defensive mechanism of the body. When there's inflammation, it means body is trying to heal itself. You know, as a sign, there's a redness and there's a heat, there's a little swelling, and there's restrict movements and pain. So these are all signs. Why? Because blood rushes towards that area, because blood wants to take care of the situation, whatever is going. It's like a high risk situation. So during this phase of inflammation, what happens, there's a lot of influx of neutrophils, and neutrophils, as we know, they do phagocytosis, which means they engulf the bad bacteria or pathogenic microorganism or toxic waste or debris or worn out cell, so whatever. And so they do all the healing as a response to inflammation. The other is, there's monocytes in the same blood. Monocyte, they go through a series of changes. They convert into macrophages, and macrophages, like, they become like phagocytic properties. They already have that. It's like they start engulfing that. So now they become, when they engulf the bacteria, the macrophages, they become antigen, and when they become antigen, they cause creation as a response of many antibodies. So this is how they activate the immune system now. So many other factors how it helps. And then the secretion of many, when we make pricks, as I mentioned in the beginning, Hijama, the extraction of blood, is just one of the factors how Hijama helps. It's multifactorial. When we make pricks, as a response to this pricks, a lot of positive secretion take place. For example, endorphin and enkephalin. These are so beautiful hormones that they secrete in the body, which causes relaxation of body. They are mood lifters, and dopamine and serotonin hormone, they are secreted. And they are natural painkillers also. And one hormone called interleukin, which balances or modulates the immune system, also gets secreted into it. So it's really awesome. The other is Chinese medicine theory. The acupuncture. Acupuncture is endorsed, approved system of medicine from WHO. Now we know that Hijama pricks are more stronger than acupuncture. So whatever happens as a response to acupuncture needles happens also with the needle of Hijama, but in a more stronger way, in a positive direction. So this happens. And then the local thing, there can be stagnation locally. So there's a pain or muscular spasm or something, or lactic acid stimulation or secretion or accumulation. When we do Hijama, we just extract that out. Now, from a Unani system of medicine point of view, there can be a morbid humor. There can be a khult, which is a little aggravated. So you do tanqiyah of that, you do ikhraj of that, just extract that out. So from that point of view, it really works. Unani people who are expert, they know, mashallah, they are good at knowing about the mizaj and khilt, and what khilt is aggravated at this point of time. So they work on this accordingly. So it's one of the best things for that. Now there's a spinal theory. We have the whole spine, and we have whole nervous system running through that, and through the foramens of the spine, the ganglionic fibers of the nerves, they supply the whole body. So it's like, from the back, the whole body is taken care of. So when we do at certain points, we trigger many of the corresponding organs attached to that. So it's like, for example, if we do it just at the base of the skull, this area is responsible to supply through the eyes, through the thyroid, through the brain, so many, so it's really one of the best parts. Now in the upper part, for example, if you do alcoholism, this is good for your thyroid, for your lungs, for your heart, and so many things. So so we sometimes do Hijama based on spinal theory only. And there's a lymphatics. We have a lymphatic channel, like we have a blood system, we have a lymphatic system also. The role of the blood is to collect nutrients, collect oxygen, collect glucose, and then supply all over the body. But the role of lymphatics is to collect the debris. They collect the unwanted things from the body, the ammonia derivative, the waste products, worn out cells, even sometimes cancer cells, and then just extract that out. Generally how it does, it collects it from the blood, collects it different interstitial tissue spaces, and then just pours in the intestine, and then we excrete that out. But there's one thing, limitation with lymphatics, that to move blood we have heart that pumps the blood throughout the body, but for lymphatics we do not have any heart. Lymphatics move only if we move. So if we are not physically that active, we may have slowed down lymphatic system. So when we do hijama, because most of that lies in the back, so when we do hijama, we extract that lymph fluid also out. So alhamdulillah, there are so many ways, still we are learning more about hijama, mashallah. So what we already know is quite strong. And that's why these days, mashallah, you see that people are doing hijama. Even a lot of sports people are doing hijama, and it's like in many hospitals in Germany, in America, they have started doing hijama. But alhamdulillah, we do it because of Rasulullah sallallahu alaihi wasallam said it. So inshallah we'll continue doing that, and we will benefit from the science also. Why not? So, but now one thing, sometimes people think if I'm doing hijama, then I will just quit all my medication. No, it is never advisable to do that. Just keep in touch with your doctor, and he will advise you best. And even Rasulullah sallallahu alaihi wasallam, he did that, and he still advised take habbatul baraka, take kalonji seeds like it's medicine. He says take honey, and do many other things, and take ajwa for example.